This is a rat patient with a small mass, female, 2-year-old. Tiny lump. Make a little incision to get started. Usually you make a circumscribed incision, but this mass is so small. Usually people will come in when it's much larger, which you don't want. But this one is not the case. You got to reveal that under the skin, resect that lump. Do what's called an undermining of the tissue. It feels like a spherical, soft mass. I can see it there. It looks glandular in nature, so it could potentially cause some problems for the rat. And you know there's some blood supply, so you got to be careful. Alright, that looks like the culprit in action. So look at that. So look at my aftermath. No gross hemorrhage. Alright. Take a little bit more of this tissue here. You can see that our breathing rate is good under that drape. All right, I'm gonna go ahead and close. I try to close most of my surgeries in 2 layers, subcutaneous, and if I can make an intradermal, I think it's less likely for the sutures to be bothered by the pet, whatever it is, dog, cat, rat. And so we try to do it under the skin and get some tissue glue and make a good seal. Do a couple of probably horizontal mattress sutures, something to try to make sure we get this closed up decently. This probably will do it, actually. You see that subcutaneous fat. You seal that up, prevent the buildup of what's called a serosa, where fluid wants to build up between the body wall and under the skin. If you can seal as much of that up as it was in the natural state, have less of a chance of causing you trouble. There you go. So I do 4 throws. 2, 3, and 4. So essentially 2 square knots. See how that's coming out square, coming down tight. Okay, now let's do that intradermal. See what that'll get. Old breathing rate is looking good, about 30 a minute, 40 a minute. Okay. careful, your intradermal will come out through the skin and you have to do it over. So that's on one side, go to the other, lift another area of skin and come through. People call this subcuticular intradermal. See how it's coming together nicely? Beautiful, beautiful. Okay, let's go ahead and continue bringing this on down as a simple continuous pattern so much that you're saving time with your exotic patients. You know, I was told many years ago that speed was more important than sterility. Well, sterility is important, but you got to be quick. You don't have as many, you can't intubate them with the endotracheal tube, at least most people can't. And you just have less at your disposal. You don't anesthetize as many rats as you do dogs and cats. So your anesthetic safety margin is not as good. I'm going to go ahead and get some tissue glue now, and we'll close that up. That's going to seal up nicely. A drop of tissue glue and it'll seal up just fine.